My next guest is Governor Jim Justice of West Virginia, a state that stands out for its vaccination success rate. West Virginia has deployed its independent pharmacies to administer the vaccines while using the National Guard and state agencies to plan the vaccines movement. Governor Justice, welcome to the Hill, and thank you so much for joining us today. Listen, I'm following your Twitter, and you've got this tweet. I'm going to read it for a minute from yesterday. You say, today I announced that COVID-19 vaccines will now be available to residents ages 50 and above, education workers 40 to 50, and ages 16 plus with certain medical conditions. I have to say, I do a lot of scouring of the country and leaders, and I have not yet seen a tweet from any other leader that's opened up the aperture that much on COVID vac. So what's the secret sauce? And, is this encouraging people to move to West Virginia?
Well, Steve, thank you so much for having me. And people should move to West Virginia. I mean, it is an incredible state. It has 4 unbelievable seasons, and the economics of what we're doing here is terrific. And our state's in great shape, and we're just going to continue to do that. But Steve, at the end of the day, we're a practical, common sense thinking peoples. And, to brag about our people are craftsmen and they're faith-based, and they know the difference between right and wrong. And they're just good, sound people. But what really happened here in West Virginia was just this. We identified immediately this was all about age. And with that, we really just got after it. We didn't let vaccines get sitting on the shelf in warehouses while we were trying to devise some program, to be able to try to figure this thing out, some bureaucratic program. I mean, Steve, I say this all the time, but the definition of committee is a collection of individuals that individually cannot accomplish anything, but collectively they can decide nothing can be done. And that's what happened all across our country. And we had vaccines piled up all over the place. But nevertheless, what we did in West Virginia was we got our local pharmacies involved, our local health clinics involved. We got our National Guard really involved, and we got putting people's shots in arms. And really, Steve, it's amazing, but you just think for weeks and weeks and weeks, every single shot that comes into the state of West Virginia, every single one within the week that they get here, we've got them in somebody's arm. And we've done it and done it and done it. So now that they're ramping up, vaccines and the number of vaccines, and J&J is on the way, we're able now to drop our age down to 50, able to really double back and get our teachers that are under the age of 50. We're going to start from 40 to 50. And we got a lot of kids out there that are 16 to 18 years of age that have all kinds of problems and issues and everything that make them more exposed. So we're going to go get them too.
Governor, how are you communicating with your constituents? One of the things we're looking at is trust in communication today. I've spent some time in West Virginia. I just always want to spend more time in West Virginia. But you got a lot of different pockets, a lot of different kinds of communities there. What is the playbook for reaching them? How much of it is digital? How much is it the local doctor? Or I'm just sort of interested in how you reach your folks.
Well, to be perfectly honest, I had a briefing every single day, 5 days a week. Now we've moved it to Monday, Wednesday, and Fridays. But Steve, I come in front of our people. I answer any question that the press may want to bring up at the end of the briefing. But I go through every single thing. It is completely transparent because you touched on one thing that is everything. That's keeping everybody pulling the rope together. I mean, when you got factions that start out in different ways and everything, it just fragments everything. And I have kept the people of West Virginia all pulling the rope together. And truly, it is an amazing accomplishment for a state that is the 3rd oldest state. We don't have an ocean anywhere to protect us. And in addition to that, we've got all these chronic illnesses and everything. For West Virginia to have been ripe for disaster, to have absolutely led the nation, it's phenomenal. It is phenomenal. And the whole secret is exactly what you just touched on. And that is the very way you message and keep the people together.
One of the things that I've been looking at is this question in some communities of hesitancy about the vaccine, skepticism about the vaccine. I'm just to be very honest. One place I would have thought, given, political, I would have thought you would have more skepticism in West Virginia. It's turning out to be absolutely the other way around. What's the secret sauce of that? I mean, we're talking about Washington, D.C. Capitol Police. 40% of them, they could be at the front of the line, still haven't gotten vaccinated because there's skepticism there. But you've been able to bring these folks along, and I'm just sort of interested in what can be heard, about what you're doing that might be replicated elsewhere.
Well, first of all, Steve, you got to recognize that I'm a great 350-pound cheerleader. I don't look real great, but I'm good at that. And the other thing is this: I'm good at it because I tell people the truth, and that's my foundation of everything. And I'm going to continue to do just that. Transparency is really, really big, but trust has to be earned, and the people of this state really do trust me, and I'm not going to let them down. So with all that, we still have issues here, just like everywhere else, where people are skeptical about, getting a vaccine. I tell them Monday, Wednesday, and Friday, almost every Monday, Wednesday, and Friday, I said, you have got to get your vaccine. Please, to God above, don't believe these people that are trying to tell you if you take the vaccine, you're going to grow antlers. I mean, you've got to get that out of your system and get it out of your system now, because all the medical experts are telling us exactly what this is. The downside, the number of bad stories around the vaccines are next to nothing. And the bad stories around the situation that if you get this dreaded disease and everything, it's going to eat you up.
Governor, is there a chance to build on what you've done in West Virginia? Now, I'm just going to be candid. I've talked to other legislators from West Virginia, both senators, et cetera. Opioid crisis has been high and reaching people during a time of real stress out there from this pandemic. Is there an opportunity now to take the success you've had in communicating with your public, moving them on the right health care track, and looking at how you build on that in things that aren't related to COVID now?
Steve, I absolutely believe that with all in me. West Virginia's total image has really transformed into a different type of image today. Now the whole world is looking at West Virginia saying, dag, is that the diamond in the rough that we missed? And with all of that, whether it be, all the drug issues, whether it be, just the sheer, education issues, or the sheer idea of keeping the economics running in the right direction. West Virginia right now, believe it or not, Steve, is right on the cusp of doing away with our personal income tax in this state and being the most northerly and easterly state in the nation that is close to that population that won't have an income tax. There is so much good happening in West Virginia today, it's unbelievable. And the myth that, West Virginia is behind or backward or whatever it may be, is just a myth. We've got really smart folks here that have done a lot of good stuff, and their morals are so well-based and everything that they're just good people.
Well, I got to tell you, we're taking questions in the audience, but I'll just tell you before I bring on Jennifer here in a moment, one of the things that really blew me away is you get 100%, as you just said, 100% vaccination rate with the vaccines you're receiving. And I don't think that's matched by anywhere else in the country, not at 100%. So there's something pretty remarkable there. And I just want folks to understand that is not an easy thing to accomplish. We have a question for you from Jennifer. Jennifer?
How are Mayor Garcetti and Governor Justice disseminating fact-based messages to their populations? Have they launched mobile campaigns? And what about for those with inconsistent or no internet access at all? How will they be educated? Thank you.
Great. And that was Jennifer Gerber. Jennifer. Governor?
Jennifer, I want to answer your question, but Steve, you've got to repeat her question for me because I couldn't quite hear her question.
She was asking how you are disseminating fact-based messaging, how you're launching mobile campaigns, perhaps, how are you reaching a community? So I think one of the points of tension out there are fact-based campaigns and how governors like yourself are communicating them and how you're dealing with disinformation. Well,
first and foremost, Jennifer, thank you again for the question and everything. Let me just say this. It always falls back on this. Is the governor a politician, or is he really telling us straight stuff? And is the mission that is happening all around him? Is his leadership team? Are they advised, or are they fragmented? My leadership team constantly knows what the left arm and the right arm are doing, and absolutely I know what they're doing all the time. With all that, all the messaging goes out into, if you talk about a place that could have been really tough to get the messaging out, it should have been West Virginia. But again, the reason that we stay just the way we stay is because we all know what each other's doing, and we all just continue to work it in as favorable way as we possibly can all the time.
Governor, I just want to ask you finally, we have had an inflection point in administrations, presidential administrations. I was talking to Andy Slavitt a little bit earlier on kind of what's going well, what hasn't gone well. From a health perspective, from a COVID perspective, have you noticed any changes that have mattered on your dashboard in moving from the Trump administration to the Biden administration?
Well, Steve, let me say this. We want to be super respectful to the Biden administration because, President Biden is our president, and we're going to be super respectful. But at the same time, we want to be thankful, too, for what President Trump and his administration did as well. Let's be fair. When they took over and everything, when this thing hit them, no playbook, and they went from scratch. Now, when they passed the baton on to President Biden and everything, he has taken off with it and taken off with it very favorably as well. So we give lots of kudos to both. And at the end of the day, this is tough stuff. That's all there is to it. Pushing the right button at the right time was always really tough. And a lot of tough decisions and a lot of prayers. But we give both of them real kudos here.
Well, Governor Jim Justice of West Virginia, I love your state. Thank you so much for joining us. I hope you'll come back. I loved having this conversation with you.
Listen, I'll come back anytime, Steve. Thank you so much for all you do every day.
Thank you, Governor.